Breast cancer is the most common cancer in the whole of India. If you really see, we are finding more amount of breast cancers are there. But then in today's life, if you're going to have women in the 30s and 40s with one breast and then there is no breast on the other side,
they are not at all, even if they want to get the reconstruction done, they are suppressing it and they're not able to make the choice.
So I think the first time when we speak to the patient, we don't talk about reconstruction at all. Although a lot of women want to have the breast reconstructed, the incidence of delayed reconstruction is extremely less.
Can Coimbatore become a medical tourism hub for breast cancer surgeries?
Coimbatore is already a hub for medical tourism in so many different fields.
And who was your inspiration or who motivated you to choose oncoplastic surgery?
Well, soon after I finished plastic surgery, I met Professor.
Welcome to Feminine Systems, the podcast where we not only heal or empower women, but also reimagine systems around her. I am Dr. D, an integrative gynecologist, an author and an entrepreneur. Today, we are going to talk about something not just medical, something emotional, symbolic and deeply human. Today, we have a very special guest to talk about this. Dr. Shanmuga Krishnan, consultant oncoplastic surgeon at Ganga Hospital, Coimbatore. After breast cancer, many women survive but don't feel whole. What are the options? What are the myths? What does it take to feel normal after a breast cancer treatment? Dr. Shanmuga Krishnan is an oncoplastic surgeon at Ganga Hospital, Coimbatore. Dr. Shanmuga Krishnan was a recipient of multiple gold medals during his medical career. He was trained under Dr. Krishnan, a world-renowned surgeon in a world-renowned Center for Breast Reconstruction, St. Andrew's Center for Plastic Surgery at Chelmsford, UK. He was there for 2 years. He was trained in the USA for 6 months in cosmetic surgery. He trained under Dr. Rod Roche, the Doyen in rhinoplasty and cosmetic surgery at Dallas, USA for 3 months. He visited Galveston to learn more about management and rehabilitation of burns. He also learned body contouring from Dr. Joseph Capella at New Jersey and visited other centers, including Mayo Hospital. Ever since his return to India, he is practicing as a consultant in plastic surgery at Ganga Hospital, Coimbatore. He is passionate about skin donation and speaks about it at various camps and forums. Beyond medicine, he loves watching cricket, good food and spending time with his family. I'm very happy to welcome Dr. Shanmuga Krishnan to our Feminine Systems podcast. Welcome Dr. Raja to our show. Dr. Raja, what is the breast cancer scenario in India currently?
Breast cancer is the most common cancer in the whole of India. If you really see, 1/4 of all cancers among women is breast cancer.
Okay.
And if you see the number of breast cancers in men is extremely rare. But in spite of that, if you're going to combine both men and women together, still breast cancer is the most common cancer in India. It is so common.
Okay. So is there any changing trends you're observing currently in the age of incidence and all that?
So now we are finding more amount of breast cancers are there. And the other disturbing trend is that we are finding a lot of women in their early 30s and 40s with breast cancer. When I was a medical student 20 years back, so we used to have most of the breast cancers in 50s and 60s. Very rarely did we ever see a woman in 30s and 40s. Now most women come only in their 30s and 40s, and very rarely do we see women with 50s and 60s having breast cancer.
Surprisingly, I know quite a lot of young women having it, and most of the time it presents in a very aggressive form and a late stage of diagnosis also, right?
Yeah.
So what is the reason for this changing trend? Why do you think this incidence, which was like breast cancer, was a disease of old age or postmenopausally, people after 50, 60 at least, were the people who are at high risk. Now it is 30s and 40s. Why is this shift happening?
They say it is because of a lot of environmental changes. They say that so there's something called as the estrogenization of the society. I think in
Come
the
again?
estrogenization of the society. So
Okay.
what happens is that I think in the food that we eat, in the water that we drink, and all these sort of things, there's so much amount of more estrogen related compounds that are coming in, and so that they say is the increased incidence for of infertility in women, an increased amount of gynecomastia in men, increased amount of infertility in men, and the increased amount of breast cancers in women. And if you can see that, then if you see the prevalence of young girls going for menarche,
Very early. That has
they go,
shifted.
yeah, they
Right?
actually go to age very fast.
Correct.
Previously, they all used to go to age only in their 14, 15 age. But now a lot of them are getting
They are
coming of age
menarche.
around 9 years, 9 years,
8 years.
8 years.
Very, very common. Dairy also, like sometimes they say these hormone fed cows, so sometimes that has a role. Now late childbearing, because people are opting to have children later, one kid. So there is always a continuous estrogen, unopposed estrogen in our system, a woman's body most of the time. So this, and let's get to the roots, and we want to understand, this is a niche. What is oncoplastic surgery? How is it different from traditional breast cancer surgeries?
Yeah. So previously, for breast cancer surgery, what they were thinking of is they were looking at only decreasing the mortality. So that was their only aim. They wanted people to live. But nowadays, with the advancements in medicine, with so much of science breakthroughs, now what we find is that approximately 90% of women beat breast cancer when presented in the at least within the first 3 stages. So if we are going to have 90% of women beating breast cancer and living, it is not only about making them live, it is also about the morbidity of the women after the breast cancer surgery.
surgeries.
So previously what they used to do is they just used to remove the breast. And if they're going to remove the breast, and then they just told that it is for cancer and we have to remove it. But then in today's life, if you're going to have women in the 30s and 40s with one breast and then there is no breast in the other side, what happens that women get very conscious about it. It is very difficult even to get a bra for them.
Correct.
So it is very difficult to get into different clothes. But previously people used to come in some very loose saris. Now you don't have people coming in loose saris. They want to have some nice dress.
Correct.
So if you have one dress, one side you have a breast and the other side you don't have a breast, they get it very, very difficult. They find it difficult to look at their partners. So then they have so many other problems they have. So each time they look at themselves in the mirror, they're getting reminded of the disease itself. So it may be probably around 5 years, 10 years down the line. Still they get reminded of the disease. It's a big scar for them. So they all would like to come out of the disease, and that's why they would like to go for breast reconstruction. So now we are not only looking out for mortality, we are looking into restore women just like what they were before breast cancer diagnosis. So before breast cancer diagnosis, how they were, similarly after breast cancer treatment, they should be the same way.
One of the philosophy of our Feminine Systems podcast is like, we are enabling systems where people don't just survive. We want people to thrive. So be it women, be it men. So this is our core philosophy of this podcast series itself. So it is at the right juncture where you talk about, no, it's not about a deadly disease where people just have to survive. How do they live a dignified and more normal life after breast cancer? So this the options are not even known to many. How much do you think people are aware about options in this oncoplastic breast reconstruction, and what it is exactly? What do you do actually?
So we actually did a study among women, both in Tamil Nadu and Kerala. I think most of the women were from Tamil Nadu and Kerala. We found that for close to 50%, around 49%, heard about breast reconstruction, which I felt was a big thing. So probably the method that okay, there's something could have been reconstructed. I think that's what they did.
No, most people think it is only it's available outside India, not even in India. This option is many people. I did before planning for this podcast. I asked a couple of people on a very just a direct one-on-one survey kind of thing, where I questioned many people. People are not aware. Very educated people, they were not aware. There is an option after breast removal after a cancer, where there we can reconstruct a breast which will look very similar. It's not an implant based thing, but it is a reconstruction of a breast which will look very normal and similar. Most of them in my survey, I should say, only hardly one or two knew it. They were all not doctors, but they were quite educated, well educated. The awareness is very, very less.
Yes, ma'am.
So how many reconstructions you and your team have done in Ganga so far?
So far, we have done around, I think we've been doing around 80 to 90 reconstructions we have done.
80 to 90, okay, very interesting. So,
over the past around 5 years, 5 to 6 years?
5 to 6 years.
Well, it's not, people are not too aware of it.
What percentage of the people who undergo mastectomy for cancer opt for reconstruction?
Our percentage of people who opt for reconstruction is quite high. We around 50 to 60% opt for a reconstruction. This is aligns with the amount in the Western society as well.
Okay.
Even for the Western society, in the top units, they have around 50 to 60% of people wanting to go for reconstruction. This makes us realize that Indian women's thoughts are no way different from the Western women's thoughts. They also want it. And then we also realize that it is just not about women who are rich. Even women who are poor, they also want it.
True.
It is just that it is the way it is offered to them.
And availability also, right?
Correct, it is availability. For example, when we have a breast cancer, I just show the picture of a woman with reconstruction and without reconstruction, and then I tell them, I can do a good reconstruction, and then I can do it, and this is the cost it takes. This is the time period that you need to stay in the hospital, and this is the time period that you need to stay in the hospital. What would you like to choose? And then they choose it. I think if it is offered like that to many women, lot more women will
want to opt for it.
But the matter is, it is a very technically demanding job, and so it is not available in most institutions, and not many people opt for it.
Such trained surgeons in this particular oncoplastic surgery are limited. Can I say that?
Yeah, yes, exactly.
Okay, throughout India, because it is a subspecialty after plastic surgery, and people have to be well trained, and it might not be available in most of the institutions, right?
Yes.
So, is breast reconstruction always done immediately, or can it be delayed?
It can be delayed, but we prefer to do it immediately. The reason being, it is just one surgery.
You can finish it in one shot, right? Like
exactly. So the breast cancer comes out, and the new breast comes in, and then that's it.
Okay.
So it's just one surgery, and then they are done. Then they go through their radiation. They go to the normal cancer treatment. It's totally fine. But so there are a lot of women who have their breast removed due to various reasons. They may not know of this option for breast reconstruction at that initial time. They can always get it reconstructed.
At any time.
At any time.
Is nipple reconstruction or tattooing an option, and how real does it look?
So, after doing the breast reconstruction, nipple reconstruction can be done. It looks very real actually, and then people like it. But actually, a lot of women sometimes they just don't mind the nipple and the reconstruction and the tattooing. They just like the mold. They just like the mold.
Okay, what role does the rest of the body play, abdomen, thighs, etc., in this reconstruction of breasts?
So, when we go in for a breast reconstruction, so we need to get tissue from somewhere else. So the best area to get tissue is actually from the tummy of the lady. So almost all the ladies who are given birth to children before, they usually have a pendulous abdomen because of the loss of elasticity, and so it's just basically a tummy tuck operation. So they get a tummy tuck operation. That tissue we take it along with the blood vessel, and then we put it onto the blood vessels in the chest or in the axilla, and then we make it into a new breast. So that is our most favored form of reconstruction. This is called as a DF flap. It is a gold standard method of reconstruction. But at times what happens is that the abdomen may not be available due to various reasons, previous surgeries or very thin abdomen or etc, etc. And so what we do is we can even take tissues from the thigh, upper inner thigh, and then make it into a breast and then put it on here.
Okay. And can you walk us through the complications or risks associated with this reconstruction procedure? Because already somebody is having a cancer, maybe they might have gone for a pre-operative chemo, radio, and then this surgery, followed by you have to take tissue from a different part of the body and then operate and reconstruct. So any risks and complications, and what percentage of those occur?
So the first thing is that both the breast reconstruction, that is from the taking from the thighs or the taking from the abdomen or any implant, they by no way hamper the breast cancer treatment. They by no way hamper the risk of life to the patient. So these things are not there. The main complications that can happen are, we are actually taking tissues from the abdomen, and this blood vessel is connected to the blood vessel in the chest or in the axilla. Probably around 3 to 4% of people, it may not work, the connection may not work. So what happens is that they may not undergo breast reconstruction, they may just go on flat chested. So that is the major complication that is there. Otherwise, there can be some mild wound healing issues which happen in any form of
surgery, right? Even mastectomy itself, right?
Mastectomy also can undergo a lot of wound healing issues. So those sort of wound healing issues only are there. Otherwise, it's not a problem.
So in this, if this failure happens, like the 3 to 4% of women where the vascularization doesn't happen and it doesn't. So what do you do in those patients?
So in these sort of patients, then what we do is that we just tell the patient that we had this problem and we are not able to do it. And then we'll have to go on for the next form of reconstruction. So what we do is that we go on with the breast cancer treatment. And I also told you earlier that a lot of women can get their breast reconstructed in a delayed fashion, isn't it?
Okay.
So similarly, we try to do it in a delayed fashion later on again. Then we do use a different method. That's it.
Okay. What is the duration of surgery for a reconstruction?
So if you're going to look at for a reconstruction, so you're looking at around 6 to 8 hours of surgery.
Okay.
So a lot of people get very afraid about it, and then I tell them, so the patient is actually sleeping. It is a doctor who is operating.
Correct.
So it is me who has to be worried, not you.
I know.
So you don't need to be worried. So 8 hours of anesthesia in today's world is nothing actually.
Nothing. Because being into laparoscopy and things, I know this esophageal cancers and hepatobiliary, everything takes sometimes 10 hours, 12 hours, 14 hour surgeries also. Yeah. So 8 hours is, it's fine. So because it's like they're really back to normal. So this justifies that time, and it is really cumbersome on the surgeon, right? So incredible. So in your view, what does true healing look like beyond the scar?
I feel that true healing is when the woman actually feels happy, goes back to what she was doing before, leads her life entirely like what she was doing before when the breast cancer was diagnosed. I think that is true healing.
Going back to normal and
going back to normal. It's not about this wound healing or the breast healing or the breast reconstruction done. So what I always feel, I tell all my patients is, before breast cancer diagnosis, you might had a life. You must go to the same kind of life. Everything. So talk, walk, look, everything should be the same.
Agreed, agreed. So, because I want to just recollect WHO's even the definition of health, right? It is not just absence of disease. It is a complete well-being of the mind and body and the even the social
Exactly.
well-being is very important and factored. So that is real health, and that is what we need to offer today to the women today. So let's step back a bit at what age should women start screening for breast cancer, and what does the ideal screening protocol look like today? Though it's not your forte, but to make the discussion be comprehensive, what is the ideal screening protocol today?
Madam, it is still my field only, madam.
Okay, so
Whether-
because now medicine has really been so
So,
much, so many subspecialties. I will tell you in my own obstetrics and gynecology, today we have 10 subspecialties, right? So then, this has to be spoken by an oncosurgeon or a medical oncologist. So it is not even, breast is not even the domain of a gynecologist anymore at all, though patients do come to us. So I just wanted to, still the screening part of it, I wanted to ask you.
So what we tell is that when the patient is beyond 18, we have to start them self breast examination. So we talk to them about self breast examination. Basically, what they should do is that if the breast is different when compared to what it was before, then they just have to come to a doctor. And the other thing is that when the lady is taking bath, I think they should take one particular day. I think probably around 5 days from the time they have
The periods, right? Like,
or-
especially it is best on the 3rd to 5th day, right? Ideally, from the 5th day of period or 3rd day of period, where the density of like the breast tissues are little less because the hormones are low at that time. So it's a very ideal time to detect a lump in the breast, basically.
yeah, that time there's no pain.
Correct.
So there's no pain at that time.
breast.
So at that time you can go, and then when they're just taking a bath, they just need to palpate the breast. So they need to palpate with the flat of the hand. They shouldn't palpate like this. If they're going to palpate like this,
Correct.
they'll always find a lump.
Yeah.
So they'll always have to palpate the breast, and then they have to do it in a particular fashion, either from in out or out in, or in a circular fashion or something like that, so that they don't miss any part of the breast.
Yeah.
So they need to do it, and then they just need to see it in different angles. So one just with the hands by the side, one with the hands up and hands up by the side, and then they just need to see if there's any change in the how the breast looks, and if there's any discharge coming out, bloody discharge, or if any lump in the breast axilla.
Yeah.
So anything different, they just need to report to the doctor. And the other thing is that once every year, annually, above 40 years, it is told that it is better to go for a mammogram.
So this awareness on doing a mammogram every year is very low, and many fear it is iatrogenic. I mean, it can cause because it is an exposure to radiation, mammogram. So many people are afraid, and some people say it's painful. So what do you have to tell them, like
Yeah.
the viewers were like who are scared because I'm above 40 and I'm listening to the show, so let me go do my mammogram this year.
Okay. So the first thing that we need to know is that mammogram is basically an X-ray of the breast. That's it. So they think it is a very different thing. It is just an X-ray of the breast. The amount of radiation that a mammogram uses is much lesser when compared to a normal X-ray, chest X-ray. It is almost around 1/100th of the radiation. So the amount of radiation that goes for a mammogram is much lesser. Previously, what they used to do is that they used to have a paddle. When you take a mammogram, they used to have a paddle, and then the breast was pressed, and it was pressed for a long time. It was pressed for around 20 to 30 seconds. So a lot of women used to get pain. So because they have to do it in two different angles. But nowadays, the mammogram that we do have is just 3.8 seconds. So
3.8 seconds. It's just this.
it is very short.
Yeah.
So nowadays they don't need to really worry about it's going to pain a lot to me. It's not.
Yeah.
It's very different nowadays.
And it is better to get it screened so early, because even a small micro, calcification kind of thing can be detected much earlier, which can save them from the you can diagnose it at a very early stage, so and prevent them from taking a chemo radio
Exactly,
thing.
because if you're going to have breast cancer diagnosed very early, many times you may not need chemotherapy or radiation, and many times you will just conserve the breast. I mean, you don't need to remove the whole breast, you can just remove a part of the breast,
Correct.
and then you can do it. I think so. There are so many advantages of going for an early detection, and most importantly, it increases the chances of survival.
True. So, could you tell me how does your team look like? This mastectomy, reconstruction, and everything. So, is there a surgical oncologist or?
Yeah. So what we have is that a lot of people actually don't like to see us because initially because we are all men. Yeah,
Ah.
so we have a lady doctor.
Okay.
We have a lady doctor who's in the breast clinic every day, and she examines the patient, she evaluates the patient, and so on. So she does ultrasound guided biopsies also, and then we have some lady radiologist. I think in the diagnosis part, I think it is more of palpation, and then you need a lot of radiological examination, and of course then we also have a pathologist who examine it. So once that is done, then we come in for a diagnosis. Once the diagnosis arrived, and then that is when we all come in, and then we introduce ourselves, and then we talk to them. I think the most importantly, I think the first talk is only about don't be afraid. I think that is the most important talk. I think
Correct.
that is the most important. So myself, a surgical oncologist, a medical oncologist, we all talk amongst each other, and then and then we decide upon whether the patient needs surgery first or chemotherapy first, and once both of them are done, then it goes for radiation.
So, does the reconstruction affect the post-operative chemoradiotherapy? So, does it have any impact, and does it have any impact on the latest screening aspects for recurrence?
Yeah, I think this is a question that a lot of even medical professionals are afraid of, because not many people have actually seen a proper breast reconstruction. It by no way does it hamper the future chemotherapy or radiotherapy. In fact, with breast reconstruction done by autologous tissues, that is the patient's own tissues, the radiation is much better. In fact, the effects of radiation are much lesser on it, because there is good tissue, good vascular tissue, which helps to make the skins better. So that is it. And next one, regarding a lot of people think that if you're going to have a breast reconstruction done, it will be very difficult to find out a local recurrence. The answer is no. I mean, you need to do the same thing. It's just about self-breast examination, finding out for a lump. You can do a mammogram if you need to be V2. If you can have a mammogram, you can do a CT or MRI or whatever you want. Just like how you looked out for a breast cancer in the initial stage.
I've seen a couple of women. Recently, also, I met someone, a friend's mom. She was like, why is it vain to care how I look after cancer? You may also meet such kind of women in your practice. So they are like, they feel it is like my end of my life, kind of, why it's okay. So what do you say to these people?
So,
because not everybody feels like, no, I want a reconstruction. There
correct.
are women who feel, does it matter? I'm like, when I'm saying somebody is getting, having a reconstruction after 60. So sometimes there are, traditional Indian women, many are thinking in those terms, like, why do I need? So why do I have to, I will be looked down because I'm doing a cosmetic procedure. So this kind of.
Yeah. So breast reconstruction is a personal choice. There are a lot of women who are quite old and who want to have their breast reconstructed. I can just say my own grandmother, she was 85.
Okay.
And then she had a breast cancer.
Okay.
And then I did a breast conserving surgery. And then I told her that the entire breast need not be removed. Appada, she told. She told. So when at 85, she thinks it. And then there are so many ladies who are just 30.
Is it the same grandmother whose birthday is today?
No.
Okay.
So there are many other ladies who are 30 and then they just, doctor, just remove it off. I mean, it's a very personal choice. I think, but what we tell them is we just need to offer it the right way.
Absolutely. This is so philosophical. Actually, not everyone needs it, or it is not to be trusted, but a woman should be offered the choice of reconstruction.
Correct.
And it is such a personal choice, and a woman should be empowered to make her own choice.
Correct.
Right? So, this is very important because I felt, the need to do this podcast is most people were not even aware of this existence. When I just casually asked them, I didn't tell them I'm going to do a podcast. I just asked them, are you aware? And people didn't know. So, is reconstruction a one-time surgery, or does it involve multiple steps?
Yeah. So, breast reconstruction is basically a one-time surgery. And then if you want to do nipple reconstruction and areola tattooing, we do it little later. But otherwise, it's just a one-shot surgery.
Great. How can younger women, especially those without cancer, support this movement of creating awareness, reconstruction rights, and create feminine health equity in our society? Because many are not even voicing about such things. Like we did a podcast on endometriosis. Most people don't know what is it about. They just ignore it as like it's a pain. You're simply always every month you have this problem. You keep complaining pain. It is more they don't understand the intensity of it. So how can more people be interested or encouraged to involve in such creating awareness?
I think, of course, it is more about awareness. And I think if someone has a breast cancer, I think women should just directly tell, Akka, பண்ணிக்கோங்க அக்கா அந்த மாதிரி.
Yeah.
But the problem is it happens the other way around. உங்களுக்கு எதுக்கு அப்படின்னு they ask.
Exactly.
I think especially more than men, it is women who tell that, and then immediately it just goes away. So when someone in the family asks, உங்களுக்கு எதுக்கு and why for you, and then it just
considering your age, why after this age, right? Because this is what I really see.
You are married, you already had children, now why do you need
grandchildren also? Now why do you want reconstruction?
No, even children. At 30. So if a lady is 34, you already had 2 children, why do you need a breast? I think that is not right.
That's not fair.
That's not right at all.
I know.
I think one time I had a person who told a lady wanted to have a breast reconstruction. Son-in-law asked, why do you want a breast reconstruction? And then she went out.
Oh my God. No, this is not something... this happens in a very common household, regular story. This is a normal story because I've seen, let's say if somebody is divorced, if they want to remarry, the same taboo. Why you already, especially when you have children, why do you want to remarry? So you already have children, that's it. So the same thing applies to this. They are not at all, even if they want to get the reconstruction done, they are suppressing it, and they're not able to make the choice again when the family members themselves are not supportive. And I would say they are just dismissing of somebody's preference and emotions of to feel whole. It is not even about sexuality, it is about to feel complete and be normal and whole, right? So in a perfect world, what support systems would you want every woman with breast cancer to have from diagnosis to reconstruction in a very idealistic world?
I think in an idealistic world, I think the most important thing is to have a family who is just supportive of the women.
Yeah, family mafia.
I think it is just that if a family is supportive of the women, then everything will go on well.
Absolutely.
I think it is very simple, and it is the most difficult one.
Very difficult. The family is the most difficult to deal with. I think people can run big businesses and do anything bigger. But, managing the family is the most, the 4-5 people is the most difficult and challenging thing, especially for a woman. And what is expected from her is always be on the giving and sacrificing end most of the time.
Actually, what we also found is that although a lot of women want to have the breast reconstructed, the incidence of delayed reconstruction is extremely less. The reason being, they just don't have time for it. So it may need a 1 week of stay in the hospital. So that means a 1 week of stay in the hospital means probably another person in the family may also need to take some day off, or you have the children have the school timings, schools, festivals, and so many things are there.
Yeah.
So the women just don't have time.
I know.
So that is the main reason why women don't get breast reconstructed, especially doing delayed reconstruction, because they just don't have time.
No, I'll tell you this very, very. There are people whom I know, like they were in the US for some time, then came back with a 10 centimeter dermoid. It was not even a dermoid, it was a borderline ovarian cyst. Okay, 10 centimeter borderline ovarian cyst. A young woman was offered to go multiple screening. Everything was very suspicious and borderline, so we were like suggesting for her to go for a surgery. That surgery was prolonged for 1.5 years, doctor. 1.5 years. After 1.5 years, she got it operated, and luckily it was a dermoid which was non-malignant. It's okay, but I just see even for that kind of procedure, people are as you say, when they go back home, they don't want to come back for another surgery. The delayed one, I think it's best they try to be mentally prepared at the time of their mastectomy itself.
Yes.
But when they're grieving at the time, why me? Most of the time, when a cancer affects you, people are like, maybe I didn't care about me well, or I didn't eat properly, or so many things. They have a very they're scared as well. So at this time, to make them feel why and how to be making a choice with some balance. How do you do it actually? How do you really offer it in a way that for them to reclaim to their making a choice at a difficult hour?
So I think the first time when we speak to the patient, we don't talk about reconstruction at all.
Okay.
Although I'm a breast reconstructive surgeon, I believe we have to look at the women holistically. I think the first thing is that I talk to them about, don't worry about cancer. Okay, I tell them that if you're going to have your entire treatment properly done, we are going to looking at around 90% of survival, and 9 out of times 10 times you're going to do well. I will never say that definitely we will cure you. I think that's also wrong. But I will also say that 9 out of 10 times you're going to do well. Let's believe you're going to be over the 9 out of 10. I think that we have a much better chance. Let's look at it. And then I also keep telling them how to talk to your relative, how to talk to a relative with the breast cancer. And all these things I keep talking to them. I don't talk to them about reconstruction at all. I only talk to them. See, we just have around 4 components: surgery, chemotherapy, radiation, and hormone therapy.
Okay.
And I just talk to them what exactly each one is. I don't talk too much in detail about anything, because first time when you're talking to them, you should not be giving too much of information. It just doesn't get into their head.
Correct.
What the most important thing is, you just need to keep them in a good space. Don't worry, let's see, we are there for you. And then just go on. And then when surgery comes, then I talk to them about reconstruction.
Agreed. See, actually, I would like to say this is the time, today, as the longevity of people increases, we might live to 80, 90 years because of the medical advances. So everybody is at a risk of developing some form of cancer, especially being a woman, then a breast cancer being the most common. Most of us have that risk. So at the hour when I don't have a cancer, this is the time for me to know about it and make a decision and keep. In case if I have, I should opt for it and feel normal. At the time of when I have the cancer, maybe so many thoughts will be running whether I will survive and so many things. I think this is the time. So all the women out watching out there, you can Google more about this breast reconstruction. Follow Dr. Raja and the team which is doing a very good work at Ganga Hospital, and many other you can be aware and be at least educate more people regarding the same. So what is the difference between breast reconstruction for gender reassignment surgeries, augmented mammoplasties, and the other for cosmetic reasons if somebody wants to do it?
I think there are totally different procedures. So here we reconstruct breast. So when we reconstruct a breast due to cancer, we preferably use tissues from the women's body, because the women may go in for radiation at a later date. So we need to use tissues preferably from the women's own body. Here you're looking in breast reconstruction after cancer. There is no breast, and then you're totally reconstructing the breast. While in the case of breast augmentation, there is a normal breast, and we are going to make it bigger.
Correct.
So for that is a totally different procedure, because for that you just need to live. We put breast implants. We do breast implants for it, and then they become bigger. And similarly, for gender reassignment surgeries, they also put a lot of implants. Here also, what happens is that they usually give a lot of estrogen hormone therapy, which is given before the surgery, and so they generally have some form of a breast there, and then only an implant is being produced.
Okay.
So they are totally different.
Different ball game, actually.
It's a totally different procedures and different ball game.
Okay. Okay. So, can Coimbatore become a medical tourism hub for breast cancer surgeries? Because, as you say, this reconstruction demands so much of it's a technically demanding, right? It is yes. Because you are using your own tissues from ourselves. So, can Coimbatore become a medical tourism hub for breast cancer surgeries, reconstruction?
Definitely, I think, because Coimbatore is already a hub for medical tourism in so many different fields. For
Absolutely. This is something I want to really mention, right? In this country, there's this one city which was again like known as the Manchester of India. But today, I think most skillful surgeons of the country reside here.
Exactly.
Right? So, and in multiple specialities, not just one. So, I think
there's already an ecosystem for it.
Exactly. So I wish that happens soon. Okay, tell me honestly, if you are a 50-year woman and a breast cancer survivor, would you opt for breast reconstruction and justify your personal preference?
I think it depends. As I told you earlier, it depends upon women to women.
If you are a 50-year,
if I were a 50-year-old,
yeah.
I would definitely go for it.
Okay.
The reason being, I want to forget about the breast cancer diagnosis at a later stage. Say 5 years from now, I just want to forget about it. In terms of
move on.
Yeah. So I just want to move on.
Right.
And each time I look into the mirror, now the one side there's a breast and the other side there's no breast. The basic thing is that, especially I'm not a woman, but most women like to dress up well.
Yeah,
I think dressing is a part of every woman's liking.
Yeah, it's very natural.
Shopping is what they love.
Yeah.
I think women don't like it.
Yeah.
But women love shopping. And if you're going to say that you need so many kinds of restrictions on it, it's very difficult.
Very, very interesting and nice. That's very important and nice to hear from a man, right? So, men who think in this aspect. So, they are the right guests for a Feminine Systems podcast. And could you tell me what if my family member, mother or sister had breast cancer? What is the risk for me and how should I be prepared? How do I handle this?
So basically, if any person in the family has got breast cancer, they are just around 1.5 to 3 times more predisposed to breast cancer when compared to normal population. But they don't need to be worried about it. They just need to do the same thing, the self-breast examination once every month and an annual mammogram above 40 years. But then there are certain families where breast cancer is rampant. Breast cancer happens in very young women. In those sort of cases, what you need to do is that you can just do a genetic testing. Just like how you get your blood test for diabetes and so on. It's just a blood test. And after 2 to 3 weeks, the result comes. And if you are able to get some genes, so like for example, BRCA genes, BRCA1, 2 genes, and suppose the presence of BRCA1 gene, we are looking at around 85% chance of breast cancer in one side, around 50% chance in the opposite side, and 33% chance of cancer in the ovaries.
Yeah.
I think breast cancer is at least.
It's a triad, right? Like,
Correct.
yeah. So
At least in breast cancer, you can at least palpate it. In ovarian cancer,
it
they
comes
almost comes at the latest stage.
very late stage because you will not have any symptoms at all, right?
Yeah.
And
So
unless some accidental ultrasound has been done, no way you will be able to palpate and find it out.
So what we say is that once, suppose you find it out, the good thing is that even before the cancer is diagnosed, even before the cancer takes place, we can do what is called as a preventive mastectomy.
Okay.
So we do
At what age do they do that?
soon after they finish their families.
Okay.
So soon after they
When
finish,
there's a very strong hereditary.
very
history,
strong hereditary and BRCA1 gene positive. Soon after they finish their families, both the breasts are removed, both the breasts are reconstructed. So they do have their breast. It's not that they don't have their breast. And what they do is that they remove the ovaries.
As well, right?
So they remove the ovaries, and so the patient is free from ovarian cancer. The patient is free from breast cancer. I mean, this has become very popular by Angelina Jolie.
Okay.
Angelina Jolie is a very popular Hollywood actress,
Yeah.
and then for
I'm a big fan of. I
Yeah.
was a big fan, I should say. Yeah.
and then actually both her breasts are reconstructed breasts.
Okay. Okay.
And then she has married. Was married to Brad Pitt.
Yeah.
So
After that, only she was married. Was it like that?
yeah,
Okay. We didn't know. I mean, I didn't know myself, right?
I
Like,
think during her marriage she had it.
Okay. And only maybe these kind of people might need to even be screened for their colorectal cancers also. Sometimes, ovary, breast,
Yeah,
and
so-
sometimes they might be at a higher risk for even
They have pancreatic tumors as well,
as well. So interesting.
and some men have prostate tumors.
Okay, in those families. Okay. So you have you done such bilateral reconstruction?
Yes, ma'am.
Okay.
Actually, we think that it is not there in India. It is very common in India. It is very common.
It is very
in India.
common in India. Okay. So now we are moving to my favorite part of this Feminine Systems podcast. It's the rapid fire round. So you can choose to answer it in one word or yes or no, true, false, or maybe you can even explain a little bit for us. Straightforward. Can every breast cancer survivor opt for reconstruction?
Yes.
Implants or autologous tissue?
Autologous.
What do most Indian women choose?
Autologous.
Really? No, nobody is coming from implant choice.
So when you say that most of them want autologous, and then we
Okay.
did a study, and then 75% wanted autologous.
And it feels very normal, natural breast, right?
It looks natural, feels
Right,
natural.
right.
And actually, if you have a breast implant, what happens is it just becomes perky. While in the case of autologous tissues, it just flows along with the age. So it looks very natural, feels natural, goes along with the age. Autologous always.
Does reconstruction affect future mammograms or cancer screening?
No.
Can sensation ever return in a reconstructed breast?
Little.
Is reconstruction purely cosmetic or emotionally healing?
Emotionally healing.
How soon after mastectomy can reconstruction be done?
Immediately the same operation.
What's the most commonest fear women express before surgery?
I think the most common fear is, will I live?
How long does the recovery typically take?
So typically they all start walking in 2-3 days. In 6 to 7 days they're out of the hospital.
Okay. Nipple sparing mastectomy, your personal preference or not?
In select cases can be done.
Is breast conservation always possible if detected early?
Not always, because what happens is that there's a lot of multicentric tumors. So breast conservation can take place only if it is localized to one area of the breast. But then there are multicentric tumors, in situ cancers which are there in the multiple areas. In those cases, you cannot do it.
What's the biggest innovation in oncoplasty in the last 5 years?
I think in the last 5 years, what has happened is that now they're looking at trying to give more sensation to the breast. It's still not over there. But other thing is that now there are a lot of small flaps that are come in. So even for a partial breast reconstruction, we do a lot of partial breast reconstruction. So we have to remove a big chunk of tissues, and then what happens that they're not going for the entire breast removal, only a big chunk of tissue. But still, if you're not going to reconstruct anything, it doesn't look that well.
Correct.
So we're going to use tissues from on the chest or below the chest, below the breast, or from the back, and you can make it look very nice.
Interesting, very interesting. And if we are able to like make the sensations come back, it is, it's like a breakthrough, right? It is nothing like that.
It is nothing like that, but still is not yet there.
Yeah, we should be there someday. Is fat grafting safe after cancer?
Yes.
What would you tell a woman who says, I don't want reconstruction, I just want to survive?
No problem, it's your personal choice.
I like that answer. And because I think choosing is freedom and power. I think every woman deserves that.
I have no right to tell your women you need to do this.
Right.
I just need to offer them. Absolutely. And they have to take it.
Absolutely. So the purpose is, we are educating people. This option is available, and it's a very interesting option to explore if we go through something like this.
Exactly.
So you can still make a choice. There is no right and a wrong choice.
No.
So very nice. So one small personal question, and who was your inspiration, or who motivated you to choose oncoplastic surgery? What was your driving force?
Well, soon after I finished plastic surgery,
okay,
I met Professor Krishnan from UK. He just came to India. He was a big friend of my father, and then my father told Venkat, you should train him. I had no idea of breast reconstruction, but I just liked him, so I just told, okay, yes. And once I went there, then I started liking it.
Very interesting.
So I think it was the mentor and the boss that I liked.
Okay.
And I just did what he did. That's it.
Can you give one anecdote which you can recollect, which actually made you feel, wow, I'm doing a very noble service? So can you recollect an experience which you can share?
A lot of things. For example, there was a lady, 33 years or something like that. She had breast cancer surgery already done, mastectomy. The breast had been removed. She was a Tamil teacher, and then she didn't go to work. And then she came to me and told, I want to get a breast reconstruction done because I want to go to work. So actually it's 3 years down the line. So actually a lot of women actually suffer in silence. They don't tell it out.
Right.
Because they feel that if they tell it out, people may feel that they may be thought of as vain. So they don't tell it out, but then they suffer in silence. So like that. And then there was another girl, huge tumor, huge one. It was up to here, up to below her umbilicus. 22 years old.
Phyllodes kind of thing, something like
massive
that?
phyllodes.
Okay.
22 years old, and everyone had told her mastectomy, and then she didn't go for a mastectomy at all, and that's why she had such a huge one. And then we did a very good reconstruction, and then she's a totally different person. So I think we have changed the lives of a lot of people, and each life one at a time is great.
Wow. Thank you so much. It was a very incredible interview for me because this is like you fit into our podcast so well, and the work you're doing is so amazing, and we're so happy to have you on our show. Thank you so much for coming.
Thank you so much.
Thank you so much.
Thank you, madam.